Typically, the patients refer to us from a primary care doctor. When they see us, they will have a screening procedure where we do a thorough ultrasound where we look first at their deep veins, then at their major superficial veins, which is their greater saphenous and lesser saphenous veins. Then we have a consultation with the patient, and we talk to them about what the ultrasound showed, what we see visually, and what we can do to help the patient.
Symptoms that people may exhibit with varicose veins are cramps, itching, burning of the legs, having restless legs, as well as just swelling and tiredness of the legs are also additional symptoms that people can experience. Out of those symptoms that I mentioned, there are a lot of things that also cause those things, and that's why it's important to have a proper consultation with your doctor, as there are a lot of overlaps that can mask venous insufficiency. I think with my experience, or Dr. Rusnick's experience in treating varicose veins or venous insufficiency, we do a pretty good job at getting to the root of why people are having some of the symptoms that they are experiencing. The causes for venous insufficiency is still unknown, but I think there are certainly risk factors, and there are several risk factors that we try to identify. The number one cause, we think, is genetics. Age is certainly a factor, weight, sex is also a factor. Females tend to be more predisposed to venous insufficiency than males. The number of children that a female has had also increases the risk of developing venous insufficiency.
Most patients need a combination of treatment, which would be endovenous laser ablation, a phlebectomy, or sclerotherapy. We always tailor the procedure or procedures to what the patient needs.
The past treatment for varicose veins had traditionally been worse than the cure, so a lot of people just dealt with it. And I think we've come a long way from what we used to do in the past and the type of treatment we offer patients today.
EVLA is endovenous laser ablation. What it is that through using ultrasound guidance, we can place a small laser fiber inside the vein, and then we're typically talking the greater saphenous vein or the lesser saphenous vein, and we heat the vein up from the inside, and that injures the inside of the vein, but your body doesn't sense that because there's no nerves inside the vein. But your body does sense that a problem's occurred, and it'll send in cells to fix it. And in the process, it gets rid of the vein itself. So 3 to 6 months post-procedure, we'll use ultrasound and we can't find the vein anymore. Typically, the smaller veins, which are the spider veins, and the reticular veins, which are little feeding veins to the spider veins, we can treat with sclerotherapy. Sclerotherapy is an injection of an FDA-approved drug which irritates the inside of the vein wall, and it causes it to scar down and eventually go away. Sclerotherapy is typically a half-hour session. The patient can go home right away and go back to work right away. We just have them wear a stocking overnight for the first night, then during the day for 2 weeks. Sometimes a patient will need what we call a microphlebectomy, and that's where we do pull the vein out, but we use micro techniques, which is we make a small incision, less than 1/8 of an inch. The patients do quite well with this procedure because it acts more like a cut and not an incision. We do not have any issues with pain. I tell the patients to take Motrin if they need it, but rarely they even take the Motrin.
I think we offer a comprehensive care. When you go home, our job doesn't end there. We make sure we call our patients and follow up with them post-procedure to make sure that they're doing okay. We're always available. My patients have my phone number and they can always get in touch with me. You do not stop becoming our patients once you walk out the door, because this is a lifelong thing. We talk about sclerotherapy, in which we're injecting these spider veins. I think the results are immediate. For somebody to walk in the door, they can walk out the door and notice a big difference in their legs.
Every patient that's seen at Southtowns for varicose vein treatment is seen by a board-certified interventional radiologist. I would choose Southtowns Radiology because we're experts in imaging, so you're gonna get an excellent pre-test ultrasound. We've been here since 2003, performed thousands and thousands and thousands of procedures. We've had great results.